The list of hospitals in Maine that are struggling is growing, and leaders with the Maine Hospital Association are concerned. Maine General is the third hospital in the last 4 months to announce some kind of layoff or closure. And its CEO cited financial issues caused by the MaineCare funding gap. He says MaineCare has not been adequately reimbursing hospitals for the cost of care. And since the legislature struck down emergency legislation to cover the shortfalls, Maine General has been losing $600,000 a week. Despite the fact that a 2-year budget has now been passed, hospitals will not see that money until the fiscal year starts in July.
The future is very dark for us unless some changes are made, so I can't make any predictions of just quick recovery.
The association also says it has to consider changes coming out of Washington. There's uncertainty around Medicaid funding and proposals to eliminate federal tax exemptions for nonprofit hospitals. Now, MaineCare provides health coverage to low-income residents in our state.
But when it comes to paying for mental health treatment, the federal government has set strict conditions for how its money is spent. Now, as Donovan Lynch reports, the state is trying to change that.
In a packed committee room in Augusta, Mainers share the toll untreated mental illness has taken on their families.
Our mild-mannered son has become increasingly threatening and violent.
My wife and I placed his cremains into a hole in the ground in a cemetery in North Anson.
But this anguish is in service of change. On Monday, lawmakers heard public testimony on a bipartisan bill that would unlock millions of dollars in federal funds for mental health care in the state.
We need more leeway to individually treat people.
Specifically, the legislation and a very similar effort by the Mills administration is all about securing a release from federal rules that prohibit Medicaid money from paying for care at psychiatric hospitals with more than 16 beds. Right now, the state does have an exemption from that limit, but the care is related to substance abuse. What supporters are pushing for now goes further.
It's really, again, about strengthening the community-based care and the transitions and making sure that our entire continuum is supported.
Michelle Probert is the MaineCare director at the Department of Health and Human Services. More than just securing federal Medicaid money at larger psychiatric hospitals, she's also leading the effort to seek coverage for outpatient programs, like helping prison and jail inmates with mental health issues receive care as they transition out of incarceration.
We all want them to be better served in the community.
Resistance to this broad effort coming chiefly from advocates worried that money gained would be used to expand the size of psychiatric hospitals at the expense of other solutions.
Just to say, oh, we need to build more beds, really isn't going to fix the problem if you misdiagnose the problem.
Finding the resources to fix that problem front and center in testimony Monday from Nicole Hurling, whose brother Robert Card, in severe mental illness, took the lives of 18 people in Lewiston.
I searched for help, but the system failed us. And the truth is, my family is not alone.
In Augusta, Donovan Lynch, News Center, Maine.